antibacterial envelopment to prevent cardiac implantable device infection. Definition: infection after placement of cardiac implantable electronic device are associated with substantial morbidity and mortality. There is limited evidence of the prophylactic strategies other than the use of preoperatory antibiotics to prevent such infections.
Number 7. Antibiotic envelope for cardiac implantable device infection prevention.
Pacemakers and defibrillators are life-saving electrical marvels, but do not come without risk. Infections occur in 1 to 4% of cardiac device implantations and can lead to a 25% one-year mortality rate. Treatment costs average around $60,000. Until now, giving the right antibiotics right before the procedure was the best and only proven way to prevent infection. Despite this, infections continue to occur. The recent innovation of an implantable antibiotic envelope ensures delivery of 2 antimicrobial drugs locally in the pocket for 7 days after implantation surgery. The week-long release of the drugs minimizes the risk of infection. The absorbable envelope received FDA clearance in 2013, but healthcare professionals were awaiting results from the landmark worldwide randomized RAPID trial. The findings, published in March, show a 40% reduction in major infections, making cardiac implantable device procedures safer for patients.
Applications in medicine. It is estimated that 1.5 million patients receive cardiac implantable electronic device worldwide every year, despite the use of various antibiotics, prophylaxis regimen, and advocacy of best surgical practice by society. Consequence statements. Infection after replacement of CEIDS remain a major complication and are associated with substantial morbidity and mortality, and health care utilizations. Etiology. CIED infection is a rare but serious event, and its management requires prolonged hospitalization, which involves device and lead pressure with adjuvant antibiotic therapy. Risk of major complication with lead extraction is low, approximately 1 or 2%, but this can be fatal, usually caused by bacteria.
Infection is not something you can treat with antibiotics alone. It's the consequences of the infection that makes us really feel very concerned about it when it happens. To prove that there's an additional intervention, additional therapy that you can provide as a preventive measure and was able to cut down the risk by 40% is something really remarkable.
77 years, nearly 40% of patients die within a few years of implantation. And all of you know that the longevity of the pacemakers with the new batteries and new circuitry will increase. It's now 11.2 years, it may increase to even 20 years. And in that case, we'll have a large number of potentially reusable pacemakers, which can, I'll just skip some of these slides. Coming to the battery life, the battery life is the problem. So one potential limitation to the supply of reusable pacemakers is device longevity. Now 18% of pacemakers collected from funeral homes in the United States. Remember, United States and the FDA had been blinking for reuse of pacemakers, and now they have started in quite a big way. I'll come to the organizations in the United States and in the United Kingdom which are dealing with reuse of these pacemakers. So 18% of pacemakers collected from funeral homes and crematories had at least 75% of their original battery life of greater than 48 months of battery life remaining. And more importantly, what was presented at the European Society of Cardiology in 2010 was 328 extracted ICDs of living patients. 74% of devices had been removed for clinical reasons not related to battery life, had a remaining expected longevity of at least 50% of.
Diagnosis. Tests used to compare or rule out endocarditis include blood culture test, whole blood count, endocardiogram, electrocardiogram.
In general, our pacemaker or ICD patients are actually normal patients and they can do everything. They can really continue their regular housework, what they actually normally is doing. But of course there are some limitations, especially if they are treated by other doctors. So let's have a look, imaging. Computer tomography is not an issue. Ultrasound, no interference. But if you use MRI, there is a potential risk of having interference.
Symptoms: fever, shortness of breath, weakness of fatigue, slowing legs or abdomen, change in heart rhythm, dry or persistent cough. Treatments: CIED pressures at the symptom center, intravenous administration of cefazolin before to reduce the risk of infection by 81%.
Greetings. My name is Zerelda Esquer Garrigos.
And I'm Rezvan Sohail.
and we are the authors of an original investigation in the Mayo Clinic Proceedings titled Comparison of Clinical Presentation, Management and Outcomes of Cardiovascular Implantable Electronic Device Infections due to gram-negative with gram-positive bacteria.
Cardiovascular implantable electronic devices, or in short we call them CIEDs. They include permanent pacemakers, ICDs, and cardiac resync therapy devices. They're increasingly being used for the management of various cardiac rhythm disorders and heart failure. Infection is a serious complication of device therapy requiring complete removal and pathogen-directed antimicrobial therapy. Optimal management of device infection requires that we make an early diagnosis, and that is critical to reduce the
Pros and cons. Pros. The safety of efficacy of the absorbable antibiotics enveloped in the population of patients who were increased risk of CIED, bucket infection. The envelopment was significantly more effective at preventing infection than standard infection control strategy alone. The efficacy objective was met with 40% fewer patients in the enveloped group than in the control group having a major infection through 12 months of follow-up. Cons. Infection leading and the invasive procedure with or without CIED system removal, longer than suppressed antibiotic therapy, or death occur in 1.4% of standard care patients receiving high-power device. Issue applied in Ecuador. Every year, it is estimated that over 1 million patients around the world receive a targeted implantable electronic device, CIED. With the advancement the technology and widespread accessibility to CIED around the world, an entity called CIED-related infection has emerged. Over the last decade, the incidence of CID-related infection has been estimated to complication around 1% to 4% of all device implantations. Conclusion. Adjunctive or use of the antibacterial enveloped result in significantly lower incidence of major CID infection that standard of care infection prevent strategy alone without a higher incidence of complications.